This is Dr. Daniel Kelly, and this is a PNI Minute. Today I'm going to talk to you about Cushing's disease, which is caused by a pituitary adenoma making too much adrenocorticotropic hormone, which stimulates the adrenal glands to make excess cortisol. Given that the pituitary gland is considered the master gland, these tightly regulated hormones are critical to our health and well-being. With too much cortisol, which occurs in Cushing's disease, the body can develop significant weight gain, hypertension, diabetes, neuropsychological problems, thinning of the bones, and increased risk of infections. So a tiny tumor, which these are, typically a few millimeters in size, can lead to significant havoc and impairment of one's health. The optimal treatment for patients with Cushing's disease is endoscopic endonasal removal of the adenoma and selectively removing that from the pituitary gland. In the assessment of patients with Cushing's disease, it is critical to make certain that the biochemical data really confirms the diagnosis. And this is one of the true challenges of the disease. And this diagnosis is accomplished through biochemical markers in the blood, in the saliva, and in the urine. And when this process is completed in collaboration with our colleagues in endocrinology, we then recommend endoscopic endonasal surgery. The goal of surgery is to selectively remove the adenoma and preserve the normal remainder pituitary gland. In most instances, after adenoma removal, the patient's ACTH and cortisol levels will plummet quite rapidly within the first day or two of surgery, and they will go into what we consider a state of remission. And in most instances, patients who have successful surgery will require hydrocortisone replacement or replacement cortisol for 6 months to a year. And that replacement is essential so that the person can have an adequate stress response to the normal stresses of daily living. After the hydrocortisone is weaned off, the patients are monitored for many years, given that in some instances, these tumors can come back. So overall, with Cushing's disease, it is essential to make certain that the diagnosis is accurate, and then hopefully with selective removal of the tumor, the patient will go into remission and their symptoms related to Cushing's disease will resolve. Thank you.